welcome to Hadassah on Call. I'm your host, Mayan Hoffman. I have to admit, this is a bit out of my comfort zone. Let me explain. Today's podcast is diving into a topic that's not exactly dinner table conversation. Unless, of course, your dinner table is a lot more interesting than mine. We are going to talk about sex. For some, even saying the word out loud can feel a little awkward. But let's be real. Sex is a huge part of life. It's something most of us engage in, whether to start a family, for sheer enjoyment, or, let's face it, just for kicks. Fun fact, in Judaism, sex isn't just encouraged, it's required. A husband is obligated to bring his wife pleasure. And if he doesn't, well, the marriage might not be built to last. I even wrote about this during the COVID-19 pandemic, during the lockdowns when so many couples were turning quarantine into quality time and sparking a baby boom. And now, as winter rolls in, let's admit it, there's nothing quite like a warm body to snuggle up with when the nights are cold and long. So, what should we know about sex and intimacy as we age? And who do we turn to for expert advice? There's no shortage of brilliant Jewish women who've tackled this topic head on. Did you know that acclaimed therapist Esther Perel studied at Hebrew University of Jerusalem? Or that the late Dr. Ruth, sexologist extraordinaire, was once a patient at Hadassah? She made Aliyah as a Holocaust survivor, joined the Haganah, and became an ardent Zionist. Today, Hadassah is lucky to have its own expert on intimacy, Dr. Anna Wruble. She's a doctor of nursing, a religious woman who proudly wears her head covering, a grandma, and the powerhouse behind sex clinics for people of all ages and backgrounds. So, let's dive right in. I'm beyond excited to welcome Dr. Ann Wruble, the Hadassah Medical Organization's go-to expert on intimacy, to our Hadassah on Call podcast. But before I actually bring her in, I just want to send out a prayer for the soldiers, the hostages, and all of those who have been harmed by these many months of war. And now welcome, Dr. Wruble. So I want to start actually by focusing on some of our older listeners and viewers. And, with the question that I think is probably very relevant to them, which is the secret to being able to maintain intimacy as we age. Is there kind of a perfect formula for sexual health?
Thank you for the question. I think it's really important. And I think that a lot of people wonder about that. First of all, I'm going to take apart your question. The issue of our older viewers. Older is both objective, age, chronologically, and it's also a subjective.
Like when I tell my kids I'm, my age going on 90 because you're making me so stressed. Yeah.
Or your 12-year-old going on 30.
Right. Yeah.
In other words, it's also personality related. It's also personal experiences related. So if we're speaking about older, there's a physiological component. And there's also, where is my headspace? Where do I see myself? So if your question, if there's a perfect formula, I don't necessarily think there's a formula there, but there are things that we have learned throughout through research, through contact with patients. The first thing we've learned is what a person was when they were younger tends to continue as they get older.
So if you were real risque in high school, you will be when you're 60?
Well, it's something that will definitely be part of your spicing technique in your head. Obviously, if physiologically something has changed, that may need to be tweaked. That's obvious. The second thing is that being older in any way brings with it experience and brings with it life realizations. And, sometimes if we get a little bit slower or things take more time because we're older, it's actually better. Because when we're younger, possibly our agenda having to do with sexuality and intimacy may be a little bit different. On the other hand, as we get older and we begin to know ourselves better and we've had our life experiences, It's a possibility, and we definitely see this, that older men and women have actually a more richer sexual experience. Everything, and we are talking about sexual intimacy, so I am going to be fairly direct about it, using all the correct words. So, where the focus may have been on frequency of sexual intercourse, as we get older, and what is older? Are we talking about after our fertility years? Are we talking about menopause? Are we talking about into our 80s, 65 plus? What are we referring to? But as we get older, possibly our focus will be on an erotic experience, more about pleasure than about getting to the finish line, whatever that is. Maybe seeing it as a more cyclic experience than a linear experience. So if you would ask me, it's a perfect formula. Know yourself, know your head. Where are you about your age, about your abilities, about what you really want out of life?
Is there like a normal amount, let's say, for a married older couple over the going on 60 plus to be together? Is that something?
I love that question. People love to quantify everything. So again, I'm going to, and I may be repetitious a little bit this interview, and I'm sorry, because there are certain messages and myths that are really important to talk about. The word normal, okay? If two adults agree and find pleasure in what they do, that's their normal. In other words, for one couple, having sex every day may be their enjoy. And we have to talk about what does it mean having sex, okay? But let's just say, if we consider that normal, having sex, again, penetrative sex, once a week, once a month, on birthdays, these are all things that people basically decide as a couple, hopefully. I mean, that's part of the discussion also. Is there a discussion? So I'd like to take the word normal and kind of put that on the side.
Because normal is, I guess, according to every couple.
Exactly. Now, we could say that according to the literature and what we see people reporting, on an average, midlife adults report something like twice a week. But that has become almost like this criteria where people feel absolutely obligated to that twice a week. Where I would like to say, and here's my soundbite about normal and how often, you should be having sex every minute of every day.
Okay,
now, that sounds exhausting.
That's really,
I understand.
Trying to understand what that means.
If we take sexual intercourse as only one expression of the sexual experience, and we talk about signs of affection, communication, whether it has to do with sending a lovely WhatsApp or putting a note in a sandwich, but don't put it in the sandwich so the person doesn't eat it, but in the sandwich bag, or a present on the pillow. That does not have to do with, I'm only going to do that if something happens that night or that morning, but it's actually a helix of attention that raises our affection, our love, our desire to be with each other, not necessarily sexual intercourse being the linear period to the sentence of an experience. Well, then that should be going on all the time.
And you mentioned you were going to define sex. So define it for me. I mean, you kind of did now, but just expand a little.
Absolutely. So if I was going to be the Hadassah educator, I
think that is your job.
That is my job. So I would call on the WHO description that defines human sexuality as basically everything: biological, emotional, spiritual, social, political. It has many, many different facets. Now, also, intimacy has many facets. When you think of intimacy, you think, most people, I don't want to assume, Mayan, what you think, but I'm saying most people will say physical intimacy. But the truth is that intimacy comes in many different forms. There could be recreational intimacy, what we like to do together that brings us together as a couple. Emotional intimacy, my ability to trust, share without feeling judged. Feeling with my partner a safe space. That's intimacy. Now, it is true we can have intimacy with a family member, with a dear friend, but the physical part of the intimacy is what makes it so multidimensional for a couple. because one thing affects the other. Our sexual activities, what we do together, our comfort to try something new, our comfort to do what we were used to, is also based on our comfort in our intimacy.
So you keep bringing up this word intimacy, and I'm wondering, is there any question about intimacy that people are generally too embarrassed to ask that you feel like maybe we could address here?
Okay, you're asking me wonderful questions. Yes, I would say if I was really going to divide up things that people are, did you use the word embarrassed or uncomfortable?
Uncomfortable. They're both kind of synonymous.
I find it interesting that a couple can be together for 40 years and have never really talked about what's happening in their sexual intimacy experience. I'll give you an example. As we get older, both physical changes and medication, which are objective things in our life, can affect our functioning, our timing. When you take a medication can affect when you're functioning the best. Okay? I'll give something simple. If someone takes regular pain medication, what a great idea to take it an hour or some time before you're going to be physically active, so you're at your best and not feeling pain, okay, whether it's arthritic pain or other pain. I find that couples don't speak, they don't communicate often about their intimacy changes, what they would like, if they're feeling bored or they'd like to change it up. There's not again, because this is a generalization interview. There are many couples that do speak and they have found their way, whether by themselves or with therapy or with counseling, but many couples don't speak about it. As a matter of fact, it is one of the things that people often ask me, how do I bring it up with my partner after 30, 40, 50 years of being together? So that's one of the things that they're embarrassed about. And if I may, I'd like to make one other comment about physical changes. It is obvious in a couple if one partner is going through a change. And I'll give you an example. Male sexual functioning, which includes, and we're talking about physical functioning, and I have a whole thing to say that men are sometimes reduced to their physical functioning, and that's unfortunate because there's a lot having to do with emotional sexual functioning, as well as erotic play, which isn't always given space for the discussion for men. But a change in male functioning is both seen and felt by both the male partner and his partner. And a lot of times it's not spoken about, or it is given a nonverbal oive or a quiet moment because something didn't exactly work the way they wanted to work. But they don't discuss it, what we could do about it. Give you an example. Male sexual functioning for erections are better in the morning than at night. Most people have sexual relations at night after they're tired, after maybe some of their medication either has worn off or is at its height. It matters the medication. But they don't talk about it. Everybody's going into their own head about it.
And if they would, then they would just know, oh, maybe we should try to do it
Maybe
in
we
the
should
morning.
change it.
Right.
Or maybe we need to take a nap before. And these are all things. And I just want to say, we're not talking only about 65 plus.
This is for all ages.
This is for all people.
For
pregnancy, nursing. Absolutely. This will include everybody. And if you ask me what is the tool of choice, for sexual functioning for a couple, and a lot of people would like me to say, certain sexual toys or lubrication, and we could talk about that. Talk to each other, find community. And if I'm speaking about talking to each other, do it before or after, give a warning shot. I would really love, if possible, for us to really work on, being together in a more positive way. I would love to hear what would work for you. I would love you to hear some things I've been thinking about. Could we do that? And I do want to say one last line about this. I have never found a couple, and a lot of women say that they can't imagine opening that up with their partners.
I ask you, how do you get people willing to do this? Because it doesn't seem, if so many people don't, then how do we encourage them to do it?
Well, this is a very taboo subject to a lot of people. I mean, it's ironic because I'm 65 myself, okay, and I'm a religious woman. I eat the hat. It is really taking that first step into the pool. It is, one would think that for my generation, it would be easier. I always thought for my generation, it would be easier, but it still seems to be a taboo or discomfort. And I'm even going to say something else. When you come to our age group, people have a history with their partners. Sometimes that history is their albatross, is their pecula on their shoulder, is what they say to themselves, listen, we're good the way things are. I don't want to rock the boat. I'm not really interested in having any more happening between us. We've been through a lot. We've found our mojo. But the irony is that it doesn't all have to be about sexual intercourse. And possibly, and I would like to say even probably, if they would have the discussion about intimacy, about communication, they could actually possibly make a difference from some of the baggage that have built up over 35, 40 years.
I want to jump you back for a minute because you mentioned, lubrications, tools, and I know you probably don't have like a normal or this is the one tool to keep in the nightstand, but if you could recommend a tool or tools that you think are essential for couples to have in the bedroom in order to enhance the experience when relevant.
Okay, so now we're talking about tools,
yeah.
Physical tools. First of all, the bedroom, the setting.
Okay.
The bedrooms should be a safe place. It should be a private place. It should be a place where both members feel comfortable. In other words, unfolded laundry on half the bed does not give to an erotic experience. Okay? For most. Well, you are right. I should not be judgmental about, because if it's clean laundry, it may be erotic for some people. You do have a point there.
You never know.
You never know. But I really do believe, I would say 4 things that now just jumped into my head. I will say, and these are not by priority, as you get older, certain medication and changes in hormones for women do cause a certain level of dryness. So a lubricant that is appropriate for that woman, that she is allowed to use and that she's been suggested to use, would be one of the tools. And I would also say, when we say lubricants, there are many different types. There are those that are water-based. There are those that are silicone-based. There are those that are natural oils. But you also have to know your body. Some of these lubricants are not appropriate for certain body types, certain skin types. So I would suggest that you either speak to a professional, a pelvic floor physical therapist, a GYN who specializes in pelvic floor, which sounds obvious, but I mean pelvic floor in the older woman. I would really feel that way about a lubricant. So we're going to put lubricant for a second that people speak about. Sexual aids or toys. Okay, now people have to feel comfortable with it. It requires a certain level of fun factor, okay, as opposed to maybe some people finding it not age appropriate or I'm beyond that. I love when people say, I can't wear purple because that's a young color. That's in people's heads. And that's the same thing about sexual toys. Also, people have misunderstandings about sexual toys. A sexual toy doesn't necessarily have to be a vibrator, but it could be. And there are different shapes, sizes, textures of vibrators. People, and I'm going to be graphic here, people have this vision of sexual toys as being a large male organ exactly in the shape of that doesn't seem it could ever fit in any orifice. That sexual toys could be a feather. It could be something you're dressed in. It could be massage oil. It could be role-playing, dressing up. It could be many, many different things than people's visions. By the way, vibrators come in every shape and size, every color. And I very much suggest also there are professional people who actually customize the choices for vibrators for couples, for individuals. So sexual toys are definitely a possibility. But now I'm going to speak about two things that possibly people don't speak about. One of them, and both of them people have to feel comfortable with. We have to consider the fact that when we speak about couples who've been together a long time, and if we have a chance, Mayan, I also want to speak about people who are possibly alone in their life and beginning new relationships. I think that has to be a topic that we have to touch.
Yeah, I want to talk about that too.
Okay, so great. But couples that have been together for a long time to try something new. If I can use a food metaphor, which sex metaphors are always brought to food metaphors, people are used to the chicken they like, okay? Whether it's the spiced chicken, the honey chicken, the mustard chicken. So all of a sudden to tell them, how about trying, Middle Eastern chicken with olives and matbucha? I'm not really used to that. I don't know if I want to go that way. I'm pretty comfortable where I am. So the next two things I'm going to say are something that people have to really, not that sexual toys is something that all of a sudden everybody says, I'm going to go to Toys R Us and I'm sure I'll find something. But what I'm about to say is really something that sometimes people have to develop. One of the things is adding a certain something to the environment.
Like music.
Or candles, or different lighting. And possibly reading to each other. It could be reading from, sometimes very graphic sexual books. People don't mind reading silently, but they feel uncomfortable reading them out loud, or they feel uncomfortable with very graphic. It doesn't necessarily have to be very graphic. It could be a romantic book and reading it, and what did you think about that? It could be watching a movie together, and the movie could be a romantic movie, a rom-com, something that brings a couple together, something that they could talk about what they saw in the movie. And I'm not speaking here about erotic movies. I'm speaking about something you can get on, on regular,
intimate, because you
something
feel the love
intimate,
by saying
the
it
love, and snuggling together during that. That could also be a possibility. And the second point, and this is really something that people may want to develop, is something what I call journaling. Journaling to improve your sexual experience. Because I don't think it is a time for discussion when you're in the middle of an erotic experience. Sometimes writing down your feelings or things that you would like to happen between you, so that you remember during a discussion that you have what you were thinking, so that you could get out of your head during the experience and just experience it. I would also like to say, and this is an Anna Wruble red flag, sarcasm, cynicism, negativity, being critical during these discussions are an end game. If we really want to change, first of all, we have to speak in an I voice, things that work for me, things that haven't worked for me. Don't assume what the other person was thinking. And it really is about, people say, I'm ready for anything that the other person wants to do. They're not so ready being proactive, saying what I need.
Right. A lot of times I hear that.
And that's something that either somebody has to practice or seek even limited counseling to prepare their words for such a discussion.
So I want to ask you a question about the people that have children in the house. How do you do this, and especially all the fun that you're describing, when children are in the house and it makes noise when you have this much fun?
No, why I'm smiling. So why? Because you go 65, who's in the house? But kids are coming back in, also, adult children. Okay. And that's really for them and for you. Everybody's wondering what's going on. And in certain homes, the walls are so thin that if you sneeze,
especially in Israel,
somebody that's the story I always tell. Right. That or if they're living in a caravan or the walls are so thin, you sneeze and your mother sticks her hand in and says, "Has a tissue? Have a tissue." I mean, yes, this is an issue.
So what do you do? And is it okay for kids to hear it?
Wow, that is 3 different questions.
I know, I'm sorry.
It's okay. We're going to field that. I think that one of the challenges is this having sex at night.
Okay.
Personally, I find having sex at night in general, unless they've had a nap or I'm not talking about now vacation. Vacation is a tool. Vacation is a nice place to, even if you're living alone in the house, going to a different environment can really change a lot. But let's talk about being in the house. At night, a lot of people just want to read a book or watch a movie or just, go to sleep. Nighttime is not necessarily, definitely as you get older, definitely with children, younger children.
Well, but when you have younger children and you work, so there's not really any other time.
Unless you make the time.
Okay.
Unless you make the time. Unless you take a babysitter and go away for a night, or take a babysitter and let them take the kids out.
Interesting.
Okay? Spontaneity is wonderful, but it's sometimes overrated. Mm-hmm. A strategy, a plan where both couples are interested and are not being, manipulated in a not together way about it, but both couples are interested, can really make all the difference. Planning. Now, if children are living at home, some people don't have the option that a child is not in the next bedroom.
Right.
There is white noise. And I often suggest to my couples that it should be on all the time. So it's not only put on when you're together.
Okay.
I also suggest every door has to have a lock.
Right.
And it should be locked all the time. So that nobody is like standing outside with like a checklist going, door locked, white noise, we know what's happening. That.
Yeah.
And if we're talking in general, there's so many different things that can be done for the young couple, for the couple living with their parents, for the couple with young children, for the couple who has a baby in the room, but also has children in the other room that are being toilet trained. I can go on, as you can see. But if we're referring to older couples with older children in the house, if possible, there needs to be a separation, at least one room between them. The locked door, the white noise going on all the time, and also to know scheduling. And if people change their schedules, they have to inform. In other words, even though they're your children living in your house, but now we're all adults. If you're coming home from work early, you need to WhatsApp me or text me that you're coming home.
Makes sense. So I have a kind of funny question. Exercise. So, I'm a runner. I'm really into exercise, and there are days that you cross-train and you can do another activity. Now, I've read a lot that having intimate relations actually burns a lot of calories, and I'm curious.
Equal to moderate exercise.
So what does that mean? Like a half hour? Like can you kind of give, how good is doing this for you when we talk about it from a physical, exercise health perspective? I just want to work my schedules out.
Right. I totally get it. First of all, taking care of yourself, lifestyle benefits sexuality as sexuality benefits lifestyle. Okay. So if you exercise regularly and you hydrate and you eat healthy, so you will we know this, that people who exercise have more energy and they have, more positive attitude towards life. That can only be helpful to your sexual relationship as well. Now, when you're talking about calorie burning.
Right. Like, is it exercise?
Okay. It is definitely. Now, what is the it that's equal to? Is hugging 50 calories? Is kissing on the cheek only 10? But if you, deep kiss, then that's like 40 calories. And how long does it have to? Is it HIT exercise or is it low impact? I don't think I can really answer that question. I think the point is that it is definitely a healthy lifestyle contributes in many ways. Seeing your physician on a regular basis, being on top of your blood work, medication. Some of us have no choice taking medication, dosages, types of medication, even brand can make a difference how it affects your sexuality. This is another thing that people are embarrassed about, Mayan, that I have to say. Speaking to your GP about the questions you have, how your health is affecting your sexuality. I mean, your GP, who knows you, hopefully, should be the mecca, the beginning of your search for a quality sexual life. It is so surprising to me that after being with a GP for years, people feel that's not really his topic. He doesn't have time to talk about it. I don't want him to think that I'm a wild woman. They have all sorts of kind of these barriers that keep them from speaking about it. And you know what, Mayan? If you feel that your physician is not the right person to talk about, then maybe you need to find another physician or nurse practitioner to speak, a health professional to speak about these topics.
Speaking of drugs, I mean, medications that you're taking, I know with men with erectile dysfunction, they're often prescribed medication. So are there alternatives to taking these medications simply because I know they can also have side effects?
Okay. So when we're speaking about medications, Viagra, Levitra, Cialis, there's a lot of stuff on the market. In Israel, it has an interesting name. The medication is called Tarim. Amevin Yavin, that medication. But first of all, let's just talk about the medication. They have a place for people who've been assessed and determined that they can take this medication, also the dosages, and also how often. I don't put it aside that the medication there are people who take it. I don't know if there's this tendency for older people to share their medication. And that should be off the table. Nobody should be sharing all their medication. Right? No, this worked for me for anxiety. This worked for, there should be someone following you.
Yeah.
And all men should be assessed by a urologist. We know from the literature that a male sexual dysfunction can be a precursor to cardiac problems. And definitely, if the change happened fairly quickly to somebody who was functioning and all of a sudden within a couple of weeks, something changed. So, it should not be just a rote thing to give the medication, but there is a place for this medication. Also, I do want to say about it that each of these medications have both not only their side effects, but how they work, how long they work. And so people should be informed about the medication they take.
Okay.
On the flip side, there are non-medication activities, ideas that I would think, and I'm glad we're putting this in a Hadassah podcast, because in a male-female relationship, and there are men that are associate members of Hadassah that may be hearing this, it does require you to, not necessarily search for a quick fix, but to think about what is your technique in terms of in your sexual experience that you have with your partner. For example, if you're having a very quick ejaculation, what is the trigger to that? Could you possibly slow down the erotic experiences? Could different touch stimulate but not overstimulate? Okay? There's a buzzword of activity that is used now, and we're all hearing it, but it does have its place in this discussion, and that's mindfulness. Mm-hmm. Knowing your body, knowing how your body works, knowing what stimulates you and what overstimulates you. That's also very important. Kegel exercises. Women have heard Kegel.
Right.
And I'm not talking about Kegel. We've all heard it. I'm talking about Kegel.
I heard both.
Right. Yeah. Okay. Kegel exercises, that pelvic floor exercise. Women know that exercise, both against urinary incontinence and both for post-labor. Kegel exercises are really something that women have been, if they are into health promotion, have been taught, have heard about, have read about. Very few men realize that Kegel exercises can help them as well. It can strengthen their pelvic area as well. By the way, it's also a tool. We were talking about tools before, for men to possibly experience multiple orgasms.
Oh, wow.
Orgasm, very often, orgasm is the experience that's had when there is stimulation. It could be both emotional and physical. Physical, definitely to the genitalia, but other erotic areas. It's a very heightened experience. And orgasm, multiple orgasm, very often is spoken about women. What needs to be done, how to reach orgasm, multiple orgasm, the heavenly orgasm. I mean, every book that has a title of orgasm is usually quite out there. Very few discussions about multiple orgasm for men. And there is definitely that possibility for men, whether they use Tantra exercises, which is exercises that came out originally from meditation, Indian culture, but now have become mainstream in a lot of mental health, but also sexual health. And Kegel exercises, one of the simplest things to do when they're driving, when they're biking, when the men are washing the dishes. There's time.
Wait, say that again. When the men are washing.
When the men are washing the dishes. Kegel exercises are very good for men as well.
So now I want to flip back to women for a minute. We spoke about erectile dysfunction. Women, I know, as they get older, tend to tighten, even if they've had children. And that can lead to bleeding and other things during intercourse. Can you talk a little bit about that? And are there things that can be done? First of all, is it okay to bleed during intercourse? And also, are there things that can be done?
In general, because of the change in hormones, that makes a lot of changes for women. We didn't speak about desire, which I thought was going to be like your number one question.
Desire for sex. I should have asked that.
For sex.
I guess I'm thinking, well, don't people always have that?
Right. So I just want to put that out there that that is the number one question that everybody always asks
So we
about.
should answer that as well.
Okay, we should answer that well. Here, I'm feeding you. I'm feeding you the question. There can be bleeding, but for what reason? It's because that the vaginal canal has shortened, it has thinned out, is not as supple. And, the vagina in general is a muscle that needs to be exercised. I mean, if people would look at sexual intercourse like Jane Fonda for the vagina,
I was thinking, right?
So it's actually very healthy. But it has a lot of other things that go with it, a lot of emotion, a lot of opinions. I really am very pro women seeing pelvic floor physical therapist on a regular basis. First of all, they'll be taught how to do exercise to keep the vagina and the whole area, the vulva, healthy and supple. They will learn about their body. There are exercises that can be done, whether it's Kegels or an exercise regimen called Paula, spelled Paula, but Paula exercises, which work on all circular muscles of your body. I don't know if many women know this, but when you do this with your lips, making an O out of your lips, it actually affects the opening to your vagina. So using lubricant, obviously, massaging with, again, if it is permissible for this particular person, almond oil, other oils that are used. I always tell people, don't use only what you have in the house. Baby oil, because that's what you use for the diaper, or olive oil, the vinaigrette's in the refrigerator, but I also take it into the bedroom. Use the oils that are appropriate and that physical therapists are suggesting. Can you have sex when you're bleeding? Okay. First of all, there are two enemies to a good sexual experience. Okay. Number one is pain. If the person has pain, that needs to be dealt with. And we have many, many modalities of dealing with sexual pain. Women do not have to suffer, and they suffered for generations, because sex wasn't only about bringing children into the world. Sex was also a way to mediate the relationships. Sex was also a way, it was used for so many. I could give a list of what it was used for. Women should not feel pain. Pain causes trauma. Trauma causes an aversion. You should not be having pain. And there are enough modalities. If you don't find it in the physicians or nurse practitioners you've been going to till now, search for it. Okay, because there are modalities to deal with it. Now, putting bleeding also aside for cultural issues, bleeding because there are a dryness is a bleeding that's called a wound. And nobody usually has an issue with that bleeding, even for cultural issues. But it's because of, again, that thinning of the lining. And that
regrow the lining if it got thin?
You can make it more supple.
Okay.
You can make it more supple. And sex, by the way, is really healthy for the lining. Okay, you can imagine. It's like doing weights or Kegels for urinary incontinence. It's the same idea.
Interesting. Now, I know you've worked a lot with the Ultra-Orthodox community, certainly, on the topic, obviously, of sexual health. What's been most surprising or memorable that you've encountered, or maybe there's a challenge that you could share regarding that community specifically?
I'm going to combine your question, and I'm going to say what is most surprising to other people when I discuss this. And will say one word about challenges. People are people are people. And there are assumptions made about all different types of people that are not who I am. I don't mean I, Anna. I mean the I as opposed to the other. Anybody who's different. And in all my years, and I've been in sexual counseling, sexual education, both in the general community and the Orthodox, Ultra-Orthodox, Hasidic communities, everybody is searching for the same thing: comfort, relationships, how to make it better so that it becomes a part of the positive things in the relationship. What has surprised people is to hear that the same questions that are asked by women in the general public are asked by this public as well. It isn't only about fertility.
Fascinating.
Now, if I can just say one sidebar, probably the most touching experience I had was from a woman from a very, very traditional Hasidic community who did not come to me for sexual counseling. She came to me to discuss how she and her husband, this woman was in her 50s, how they can become friends. And that was very touching. That for me was truly how people seek intimacy, because it's not only that woman. In general, friendship, by the way, there's a lot of talk how is friendship good for a sexual relationship? Do we need to keep some mystery? I mean, I don't know if people have read or heard of Esther Perel having this. This is a woman who's written many books and does both marriage and as well sexual therapy in many different languages. Okay, she has a whole discussion about how to keep the mystery while you've been living together for 40 years. So I think that's also an interesting topic in and of itself. But the idea of intimacy contributing as well to the relationship and how it does, I think is across the board. So, and I have to really say that I have enormous, enormous pleasure and humility dealing with the ultra-Orthodox community, because they have taught me so much about how within a cultural framework to reach your aim of a good relationship and a good sexual relationship.
Fabulous. So I have two more questions. One more clinical, and then I'm going to ask you one, which we're going to, I guess, get into this idea of desire with that last question, since the people maybe struggle to have desire. Are sexually transmitted diseases, though, still an issue, and certainly for older couples?
Love the question. Love your questions. As people get older and possibly not have a permanent partner, okay, there is this misnomer, I guess because I can't get pregnant, nothing else can happen. But obviously, multiple partners can bring about sexually transmitted infections. And that goes across the board, whether it's, gonorrhea or syphilis, or it's across the board. So if you're having multiple partners, you do have to go back to using a barrier method, a condom. You do. And you have to know how to use it. And I also would like to speak about, sexual intercourse, penile-vaginal intercourse isn't the only position that people use. And, we are also seeing sexually transmitted infection on the face, around the lips, that is sometimes misdiagnosed. So, one has to be also protective when you are having your experiences. So I'm not saying about you need to control your experiences, but you need to do it in a healthy way. You need to have awareness.
And it's probably still good to check out the partner. I mean, they tell you when you're young, don't just do this with anyone. I'm assuming that holds true when you're 50, 60, and 70.
Yes. And sometimes partners will share where they are at, and sometimes they won't. And so your first line of protection is you. And, people think washing up or using wipes is what's going to make a difference. But no, it's the same exact thing. There, at some point, and there was actually research done of a rise in STIs in old age homes.
Oh, wow.
Because in general, there were more women than men, and there was activity going on, and it was showing up. So, and I mean, this is probably one of the myths. You didn't ask me about myths, that at some point be happy you're alive because older people are not having sexual activity, and that's a misnomer. And by the way, at the beginning of our discussion, we talked about people being in their habit, but there are also people who try to change their habits, especially with new partners, trying new things, being exposed to new things. So, be aware of your healthy lifestyle, of your habits while you're searching for pleasure.
So I feel like we could talk about this forever.
Definitely, I could.
I'm having a great time, but I think that we are going to kind of wind down. So I wanted to just ask you this last question, which is in terms of, how do you help people to build up desire, to what is desire, and what's been for you personally, the best experience in doing that, or something that you feel that you've really personally benefited from?
Okay, Maayan, can I speak about desire?
Yeah.
Is that okay? Okay. Desire has both a content and a context. Do you desire a life in general? Are you a person searching for a happy life, an enjoyable life? I'm not saying that a very extensive sexual experience that touches every erotic possibility is what's going to make the difference for you. But it does start with a desire for life, l'chaim, a desire for life. Because if you are sad, depressed, even taking certain medication that makes you that way, it is hard to pursue sexual desire. And I think that that's intuitive. How you can increase your desire is a lot of the things we talked about, which is communication with your partner, whether it's a partner that you've had for a long time or a new partner. It is reading up. It is not what people knew when they were 18 or 12. A lot of people's reading about sexual things either comes from women's magazines, which are very biased, or they come from what they remember. Maybe they read The Joy of Sex, I don't know, in their newspaper when they were young.
They were raised not even to read these things.
Right, exactly.
You got your training or whatever before you got married.
Exactly, that training. So stop when you were 18 or 21 or 25. There's a lot of new things out there. And they don't all mean that it ends with sexual intercourse. Sexual intercourse could be foreplay to other things that people do. So desire is very personal. Desire is also the context. Desire is also who you are. And that's important to realize. And that's desire for anything. People have trouble exercising as an exercise person because you have to get up and go and get out of your house and go exercise. So it's the same thing about a sexual desire in that sense. But we do have to be aware of the things that affect sexual desire. Past experiences in your relationship, your health, your medications, and so forth. See a counselor, a reputable counselor or therapist. Don't be afraid to go and talk about it. It is such a contribution to your life if it's something that you really want. And your last question was, how do I feel about it? I feel blessed. I feel humbled that people have allowed me into their personal lives. These are very personal topics. I mean, we're talking about it as if, we're out having a coffee.
Yeah, it wasn't like we talked about that this was going to be the subject. I said, oh, well, I don't know if I can do that subject on a podcast.
So,
uncomfortable.
And totally understandable. This is very, very private. Possibly women share it with their girlfriends. Possibly men say they sometimes share it. Women are much bigger sharers with their girlfriends. In general, the search, I always say there are very few people who go to therapists for mental health, even less for their sexual health. And it's a shame. So I have always felt blessed and I'm humbled by the stories people have told me. I'm very committed to work within what their goals are, but to really work together to have a positive attitude towards the sexual experience, to take it out of a taboo, to take it out of what society thinks you should be doing or what your friends are doing. By the way, one of the biggest issues for couples is comparison. Don't compare yourself not to television shows. Media is very complicated for a customized sexual experience. Work on it together. It makes all the difference.
Wow, Dr. Wruble, thank you so much.
I'd like to say it's my pleasure because it really was my pleasure to talk to you. Thank you very much. Appreciate it.